Hi guys, Dr. Kid here. In this video, I'm going to go through a review of the medication Avanafil, otherwise known as Spedra. I'm going to go through how it works, how to take it for the best effect, what are some of the key side effects to look out for, and is it better than its competitors such as Viagra and Cialis. So what is Avanafil? Well, Avanafil is commonly sold under the brand name Spedra, and it belongs to a class of medications known as the PDE5 inhibitors, and they're used for erectile dysfunction. Other medications that are in this class include Viagra, which is also known as sildenafil, and Cialis, otherwise known as tadalafil. So how does it work? Well, normally when you get an erection, you need to increase blood flow to the penis. This blood flow is provided by blood vessels known as arteries. PDE5 inhibitors, like Avanafil, increase two chemicals in the penis, CAMP and CGMP, and these chemicals help to dilate the arteries of the penis and therefore increase blood flow, therefore assisting with gaining an erection. So how do you take it for the best results? Well, Avanafil comes in three dosages, 50 milligrams, 100 milligrams, and 200 milligrams. The recommended starting dose for most people is 100 milligrams, and it's usually taken 15 to 30 minutes before sexual activity. It can be taken with or without food. However, if it is taken with food, sometimes this can delay the onset of action, and therefore if you want it to work as quick as possible, it's best taken without food. To further enhance results, it's best to avoid alcohol and other recreational drugs when taking this medication. This is because alcohol and recreational drugs can affect the efficacy of the medication and can also directly impact on the ability to gain an erection. Sexual stimulation is usually still required for this medication to gain an erection in most cases. So what are the side effects of Avanafil? Well, the most common side effects include headache, flushing, nasal congestion, and back pain. Most of these side effects increase as you increase the dose of the medication. However, interestingly for back pain, it actually had the highest incidence of side effect at the 50 milligram dose. This is a table of different side effects that patients experience and what percentage of patients experience that side effect at different dosages, and it compares it to placebo. You can pause the video and have a look through if you're interested. So who should not take Avanafil? Or what are the contraindications to Avanafil? Well, patients that are concurrently taking nitric oxide or nitrate medications should not take Avanafil. The nitrate medications are most commonly seen in medications that are used to treat angina, which is chest pain caused by narrowing of the arteries to the heart. One of the most common examples is glycerol trinitrate, and this can come in tablet form, spray, or patches. People that have severe heart conditions should also not use Avanafil. Examples of this may include unstable angina, a recent heart attack or stroke in the last 6 months, heart failure, or very severe high blood pressure. Other contraindications include patients that have severe kidney disease, severe liver disease, anyone that has a condition that affects the arterial blood supply to the eye, and also anyone that has a hereditary retinal disorder. In addition, patients should not use Avanafil if they're taking a potent CYP3A4 inhibitor. Examples of these medications include ketoconazole and itraconazole, which are antifungal medications, and clarithromycin, which is an antibacterial medication. These medications inhibit an enzyme CYP3A4 in the liver, and this will actually increase the concentration of Avanafil and therefore potentially increase its side effects. So how does Avanafil compare to the other PDE5 inhibitors such as sildenafil and tadalafil? Well, one of the key differences is that its onset of action is shorter than most of the other PDE5 inhibitors. The onset of action of Avanafil is 30 minutes or less. This is compared to other PDE5 inhibitors, which typically has an onset of action up to 60 minutes. The advantage of this is that if the opportunity arose for spontaneous sex, you would not have to wait as long for the medication to work. Sildenafil does have an oral disintegrating form that has a similar onset of action to Avanafil, and tadalafil also has a low dose once a day tablet that can be used for spontaneous sex. So there are some other options if spontaneous sex is really important when choosing your PDE5 inhibitor. With regards to efficacy, at the time of recording, there was no head-to-head studies comparing Avanafil to some of the other PDE5 inhibitors. Therefore, the decision of which PDE5 inhibitor to use initially usually comes down to other factors such as onset of action, cost, and other benefits the medication may be able to provide. So that's my summary of Avanafil. If you found this video helpful, don't forget to like and subscribe to the channel. If you're interested in comparing Avanafil to another PDE5 inhibitor, here's a video on tadalafil that has a once a day dosing option, and I'll see you in the next video.